One of the biggest fears with central serous retinopathy is this. What happens if the fluid just stays? Does it heal? Or does it cause permanent damage? Here's the straight answer. Yes, CSR can cause scarring if fluid lingers too long. And that scarring can lead to long-term vision changes. Let me break it down. In a typical CSR flare, fluid builds under the retina. If your body reabsorbs it within a few weeks or months, the retina usually bounces back. That's why many cases resolve with little or no lasting vision loss. But when fluid hangs around for months, or worse, years, it can start to damage the delicate retinal tissue. That's where scarring comes in. Doctors call this RPE changes or pigmentary changes, but what it means is, the longer the retina is lifted and stressed, the more likely it is to form scars that won't fully heal. So what does that look like in real life? Scarring can show up as permanent blurry spots, distorted central vision, reduced contrast sensitivity, trouble with fine details even after the fluid clears. It doesn't mean you'll go blind. But it can mean your vision never fully returns to what it was before the flare. Who's most at risk? People with chronic CSR that doesn't resolve in 3 to 6 months, those with recurrent flares over years, anyone who didn't get a proper diagnosis early and let fluid sit too long without monitoring. So what do you do about it? First, you have to take timelines seriously. If your fluid hasn't cleared after 3 months, don't just wait forever. Talk to your retina specialist about options like laser therapy, photodynamic therapy, or even injections. Early intervention can sometimes reduce the risk of scarring. Second, track your symptoms closely. If you notice vision getting worse instead of stabilizing, push for new scans. Don't assume the doctor will always catch it first. You're the one living with the day-to-day shifts. And third, manage the root causes. Stress, sleep, medications, hormones. Anything that keeps your cortisol high can keep the fluid coming back. Addressing those factors is just as important as the eye treatment itself. So, can CSR cause scarring? Yes, but it's not inevitable. The faster you respond, the better your odds of avoiding permanent damage. Want to know what outside triggers might delay your healing? Subscribe and check out the next video. Weather and CSR, why your vision might change with the seasons. Your eyes are resilient, but only if you give them the chance.